Kristen here at UT Southwestern Medical Center. Today we're going to be talking about CT lung cancer screening, and I'm excited to be joined by Dr. Cecilia Brewington.
Hello, Kristen.
It's great for you to be here. Dr. Brewington serves as medical director of our lung CT cancer screening program. So it's a great guest to have. Before we get started, I do want to say special thanks to the Moncrief Cancer Institute, the UT Southwestern's Department of Radiology, as well as the Simmons Comprehensive Cancer Center for helping us spread the word about this very important conversation. So the reason we're doing it is Lung Cancer Awareness Month, and obviously screening is definitely something that's out there and it's needed. How are we recognizing Lung Cancer Awareness Month here at UT Southwestern?
Well, one is to promote, of course, our lung cancer screening program. And, it's important to promote screening because we can actually make a difference in the number of people who unfortunately pass away due to lung cancer by screening and identifying cancer early. And I think that when we talk about lung cancer screening, not as many people are aware that we've made this jump. We've made a jump to where we can make a difference. For a long time, there was nothing that really affected the mortality rate with lung cancer. But lung cancer screening by low-dose CT has changed that.
So how effective, you hear a lot about low-dose CT screening, how effective is it?
Well, this all starts back through a multi-center trial that was held from 2002 to 2004 with people who were identified as being at higher risk for lung cancer development, and that was, of course, people who smoked. There was a trial that was done in the United States across multiple academic medical centers, and through this, we discovered for the first time that by early detection using low-dose CT, we could identify lung cancer at a point where we could make a difference, where it had not metastasized or spread to other organs. And we saw a 20% decrease in mortality rates. That's huge.
That's a huge decrease.
Yes, that's a huge decrease. And so that's why it's important that we get this message out so that we give people an opportunity to take advantage of this screening program.
Sounds great. So we've already got a question in here, and this is from our colleagues over at the Simmons Comprehensive Cancer Center. And the question is, does insurance cover lung CT screening, and what are the requirements for the screening?
So that's a great question. Whenever we talk about insurance, it's important that we talk about what type of insurance you're on. So for those of you who are on Medicare, Medicare absolutely covers this service if you meet criteria. Our managed care companies, our Blue Cross, Blue Shield, United Healthcare, Aetna, they also cover this as a service if you meet criteria. And so let's talk about that. Who is eligible for lung cancer screening? First and foremost, we are taking patients or enrollees for screening that have a 30-pack year history of smoking. I'm going to come back and define what 30-pack year history of smoking means in a second, but let's cover the other criteria. You cannot have a current diagnosis of cancer, of any type of cancer, because those patients really need to be screened or imaged in a different way if you have a known cancer already. Then there are patients who are symptomatic. If you're symptomatic, if you have a cough or chest pain, then you're not a candidate for screening. Screening is really reserved for a patient who is asymptomatic, meaning no symptoms. And if you are 55 years or above, that's the other main criteria that we utilize to determine if you're eligible for screening. So if you meet these criteria, then you're eligible for screening. But I don't expect any of our listeners today or viewers to remember all those criteria that I just rattled off. Instead, just call the university and we'll get you over to our navigators, and they will help you based on questions and based on your history, decide if you're eligible for screening.
Okay. So I see a couple questions in here, one from Carl and one from Andy, but you mentioned there's also 30 packs a year. Could you explain what you mean by that?
All right, certainly. So the medical community came up with a calculation of how many cigarettes does it take before you have increased your risk for lung cancer. And so what we commonly use is your pack year history. And what that means is that one pack of cigarettes If you smoke 1 pack per day for 30 years, then you have a 30-pack year history of smoking. If you smoke 2 packs of cigarettes per year for 15 years, then you have a 30-pack year history of smoking.
Wow.
So it comes down to a simple formula. The more cigarettes you smoke, the higher risk you are at for developing lung cancer, because smoking by far is the leading cause of risk for developing lung cancer.
Gotcha. So we've got a couple great questions coming in here. Here's a question from Carl. How will patients learn the results of their lung cancer screening?
So I like to think of lung cancer screening like our gold standard in screening, or what I consider to be our gold standard in screening programs, and that is breast screening, breast cancer screening. So when a patient comes in to our program and they have this test, that test is read expediently, and we then get those results out to their primary care provider as well as directly to the patient. That's one of the things that we feel very strongly about. Although you can recommend yourself for this screening exam, we want everyone to have a primary care provider to help guide you through the course of what is to come should we have an abnormal finding. But by far the majority, and hear me, the majority of patients will be normal. And that's why I don't want patients to fear this exam. This is an exam that's necessary for those patients that we could identify early and make a difference in their survival rates. But for the majority, of course, we're not going to find lung cancer.
Okay, so here's a question from Ellen, and she asks, at what age should people start getting lung screening regularly, and how often?
Okay, so going back to the criteria again, if you meet criteria, and first and foremost have a 30-pack year history of smoking, you also have to be age 55 or above. So from age 55 to age 77, that's where Medicare makes their recommendation.
Okay.
Some of our managed care companies say that end of age should be closer to the 80, 88 or further out.
Right.
And that all, again, comes down to your personal history and how healthy you are, the longevity that we expect to see in you. So we want to, again, make an impact on your survival rate. So if you have a lot of comorbidities, this may be less important to you if you have a lot of other illnesses. But for the average healthy patient, we want to help you maintain that status.
Okay, really good question, Ellen. Thanks for asking. Here's one from Crystal. And we hear a lot about, just because you don't smoke, if you're exposed to it, that can also be problematic. So her question is, what if a patient or somebody lives with someone who smokes for 30 plus years? Are they also eligible for screening?
So that's a great question. The original study did not include persons who have been exposed to secondhand smoke, but we do know that those patients or those people are at higher risk than a person who, of course, has not been exposed to secondhand smoke. We do have some very generous donations that have provided us with a fund, and we take those considerations on an individual basis. If you have had a significant exposure to secondhand smoke, if you again call our main university telephone number, the 214-645-8300, they will get you over to our navigators, and they will help you, along with our patient educators, decide if screening is something that you should do. And if it's not covered by your insurance, then again, we have a small fund that is available.
Okay, great. So for those of you that heard the number, don't worry about writing it down. We're going to share it in the comments field here so that everybody knows what number to call. It's a lot to take in right now. Here's another question. Is a low-dose CT scan better at finding abnormalities than a regular chest x-ray?
Another great question.
They keep coming in.
So that goes back to our trial, our National Lung Cancer Screening Trial that was done that gave us this great information that we could decrease mortality. They actually compared the results of doing a regular chest x-ray to that of a low-dose screening CT. And that's where we discovered that we were able to detect early cancers with low-dose CT, and not to such a great extent with just your basic chest x-ray. So a chest X-ray may pick up larger lesions, but we need those smaller lesions before they have metastasized or spread.
Okay, really great question. Thanks for asking. Looks like we've got a whole lot of questions coming in. This is really great. Keep them coming. Here's one. It's more of a comment. It's from Pere, who asks. He says, "Hello. It's wonderful advice specifically about cutting down smoking. We have a program here, don't we, to help those that are struggling?"
We do. I'm happy to say that the Simmons Comprehensive Cancer Center actually has sponsored a community outreach program that is, and definitely hear this, it is a free program to those who want to stop smoking. And all you have to do, again, is call our main number and we'll get you over to our counselors that can get you set up to start this program. And if you just have a question about the program, there's also a group that meets to just answer questions about stopping smoking cessation. So take advantage of that program. Again, it's free to anyone, not just our UT Southwestern patients, but anyone who contacts our counselors through that number can arrange to have a meeting with one of our counselors.
This is like a great resource for the community. So we've talked a lot about CT lung cancer screening and other options. So what Andy is asking, are there any downsides to the procedure or the screening?
Well, when we think about screening, screening is not without its own consequences. And I say that to say that we know that there are those of us, myself included, who might tend to worry about the findings. Case in point, every year when I go in for my mammogram, I'm just a little bit nervous about what the findings are going to be. So when we talk about screening, we're talking about a person who doesn't have a symptom, doesn't have a diagnosis, and then you tell them that you want them to screen. So when you screen, there is a period of time that you might be a little nervous about that. So that's one of the downsides. Then there are going to be those patients that we find something.
Right.
We find something, and everything is not a cancer. And so while we're figuring out if that is really a cancer or not, then that may tend to cause some nervousness in a person. And so when we talk about screening with patients, we always want to have what's called a shared decision-making visit. That shared decision-making visit occurs between a patient and their provider, their healthcare provider. And that's an opportunity for us to discuss whether or not you are a person who tends to be very, very worried, and this may not be a good thing for you, or if you're likely to be a person who would rather know that you have a clean bill of health, you don't have lung cancer, or that we've identified it early. So those are the types of discussions that happen during that shared decision-making visit that has to happen before you get a screening exam. Okay?
That's a great question. So here's a different one. How do, I just lost it, excuse me. How does somebody prepare for a screening? Are there things they need to do? I know with some screening, if you're having colonoscopy, for instance, you've got to drink stuff. Is there anything for a CT lung cancer screening?
So absolutely not. There is nothing you need to do except meet criteria and have that first shared decision-making visit with your provider. We also have mid-levels and providers on campus that can have that first visit with you to tell you what screening is. There are no needles involved. There's no pain involved. This is a painless test. All you have to do is lie on a table, and then for those of you who may or may not have ever been exposed to a CT scanner, it's a machine that sometimes can look a little daunting, but it looks like a large donut hole, and we have a table that moves your body through that donut hole. But this exam takes less than 5 minutes to complete once you're on that table.
Wow, do you go all the way through, or do you go part way in where your head's still out?
Well, you go in head first, so you go part of the way through, just enough to expose from the top of your chest all the way down to the bottom of your chest.
Okay.
We screen that area, and again, that takes less than 5 minutes.
Wow.
Then you are up and back to your daily activity.
That's amazing. So are there options for people who may be a little claustrophobic?
Well, CT scanners come in multiple sizes in terms of the size of that donut hole that I mentioned. So we do in Texas tend to have some of the larger donut hole sizes of CT scanners. So that will help to a certain extent if you're claustrophobic.
Okay.
But the other thing that we've gone out of our way to do in radiology at UT Southwestern is we've placed very pleasant scenery on the ceiling.
Oh, wow.
So we have, in some rooms, we have a sky view. In some rooms, we have a beach view. But we've done that to try to put patients at ease. And then we walk you through it. So our technologists are trained to kind of talk a patient down a little bit about the fear or an anxiety that they're having during this test.
That sounds great. I'm personally a little claustrophobic, so good to know. All right, we've got some more questions here. We are already halfway through our chat, so now's a great time to send all those questions in. I know we've got a handful right here. I do again want to thank the Department of Radiology and the Simmons Comprehensive Cancer Center for their support. Here's one. This one came in from Cece, and it's two-part. The first part, how do you, as a physician, determine if a patient should undergo a CT lung screen versus something else?
So first and foremost, we want to know if the patient has any symptoms. If you're symptomatic, then you probably need to have what we call a diagnostic CT. A diagnostic CT is done with a little higher dose of radiation, and sometimes we may do that with contrast, which is a liquid dye that is perfectly safe for humans that we put in through an IV, and we do a different type of test as opposed to a screening test where there are no needles, no dye. We simply screen your chest with a low amount of radiation. And so if you have no symptoms and you meet criteria, then you're a candidate for lung cancer screening if you have that 30-pack year history of smoking.
Gotcha. Okay. Really great question. The first part of that, her question, which I think we touched on earlier, was what is the success rate of identifying lung cancer with a CT?
So CT scanners are very sensitive. We can see down to millimeters in size of things. We identify things that are so small that we also know that they're so small we really can't do anything with that, and there's no need to do anything with that. So we do have a cutoff of about 5 to 6 millimeters where we start following a nodule. And this nodule at that size, again, this is the key principle behind the screening. At that size, the likelihood that that could be a cancer that has spread somewhere else is very small. And that's the benefit of using the CT scanner, to identify that little smaller than a peanut size lesion that we can do something about.
Okay, gotcha. Fantastic question. Thanks for asking. Here's one from RC that he tuned into our last chat. That other than smoking, what are some of the other leading causes of lung cancer?
So smoking causes about 90% of all lung cancers. Then there is a lower risk that you see with everything else. Smaller risks are seen with radon exposure, which is an odorless gas. It's an odorless, invisible gas that arises from uranium. And that's a very rare instance that a person develops lung cancer due to that. Then there are some other environmental risk factors. Exposure to asbestos, which can be in buildings, can cause a different type of lung cancer. So these, again, are a very small percentage of patients who are going to get a lung cancer. By far, the number one cause is going to be smoking.
Right. All right, good to know. So stop smoking. That's definitely a message here. Here's some questions that are more kind of procedural about coming here to UT Southwestern or anywhere if you're not in Dallas. Does Medicare cover lung cancer screening?
Medicare absolutely does. If you have this procedure performed at an institution such as ours, who is part of a national registry, that's a requirement in order for it to be covered. And being part of a registry means that not only do we screen patients, but we also submit in an anonymized fashion that information centrally to a national database. And that national database is going to help us in research further how we can help patients, how we can prevent lung cancers.
Okay, good question. Here's another one from Carl. If patients want to have a CT scan, should they just call the 645-8300 number for an appointment, or does their doctor have to put in a request?
So we do have your doctor put in a request, but if you call that number, our navigators will help you through that process so that you can get your lung cancer screening performed. If you don't have a physician, and I think this is important because everyone doesn't, we also have providers that are here at the university that will take new patients and help you get through that process. So again, we want to cut down all the barriers that would prevent you from getting this very important test. It's not too late. If you're a smoker out there, that's the message that I want to make sure you take away from today's presentation, is that just because you smoke now, it does not mean you have lung cancer. There is still time for us to have an impact on your survival as a result of smoking. And if you don't have lung cancer, there are still several benefits to stopping smoking.
Right.
You could stop smoking today and see benefits a month from now, 6 months from now, a year from now, because smoking not only is a risk factor for lung cancer development, but it has long-term risk for your overall healthy heart risk.
Right.
It's associated with heart disease. It's associated with skin cancer. There are effects on your eyes.
Right.
So we want to stop lung cancer, and we also want to help you stop smoking.
We do have a question here, and we've mentioned cigarettes quite a bit. What about our cigar or e-cigarette smokers, also subject and at risk for lung cancer?
So cigarettes cause a risk of lung cancer because of the carcinogens that are associated with nicotine. And then nicotine is a addictive thing. So when we talk about other causes of lung cancer from smoking, cigars do have a certain percentage, but that was not studied when we did the National Lung Cancer Screening Trial. So if you smoke cigars, there's not a complete one-to-one association with this result.
Okay.
That said, certainly smoking cigars does place you at an increased risk compared to people who do not smoke. Then there's also something that's become more popular amongst younger adults, teenagers, which is vaping.
Yes, that was another question that had come through. We were getting to.
So vaping can be done using a nicotine substance, and it can also be done using a flavored substance.
Okay.
If you vape with a nicotine substance, then that's addictive, can be addictive depending on the amount of nicotine, and it can also place you at risk. But again, when this study was done, vaping was not as popular.
Right.
We didn't include vaping in the study, but that research still has to be done, and I'm sure that at one of our academic centers, that's something that someone is considering now. So the take-home point, the takeaway point is that all smoking can place you at an increased risk. We don't know how much of the other smoking places you at what level of risk, but those things are being studied.
So those other things that are being studied, the cigars, the vaping, are individuals who do those, are they eligible to participate in the smoking cessation program?
Absolutely, because again, that nicotine is a addictive factor, and we know that those persons who smoke a nicotine substance can need support in order to stop smoking. And I don't want to ever take that lightly, the need for the support to help a person stop smoking. That's something that all healthcare providers recognize, and this program is for you.
Absolutely. So we only have time for a couple questions left. We're almost out. And here's one we haven't had one like this come in yet. This one is from Ellen. Are there any medications that a patient might be taking that would make them ineligible for a lung screening?
No,
Nope.
there are none. Now, but let's remember that lung screening is for the asymptomatic patient. So if you're taking a medicine because you are symptomatic of something, even something as simple as a persistent cough, then if you're really a symptomatic patient, then you're not eligible for screening.
Okay.
If you have a cough, you should talk to your provider about that cough if it's been ongoing,
Right.
to make sure it's not a sign of something more severe.
Okay, good question. Thanks for bringing it up. We got two more questions. One here from Carl. It's about the smoking cessation program. Does the program provide tools like nicotine gum or patches to help people stop smoking, or does it rely primarily on counseling?
Our counselors are prepared to offer multiple avenues to stopping smoking. I think that, it's kind of like a shoe. One shoe does not fit all. Our counselors are very well trained. They know this. And so they have a lot of tools in their tool chest to address individual needs. And so again, I would suggest that, you just take that first step and make a phone call. Come to one of the group sessions to find out more information about smoking cessation. Get your questions answered, and I'm certain that our counselors can help you come up with a program that would be more suitable for your individual lifestyle. I mean, I think that that's key. We know that people have different needs. People work. People have different work schedules. They may need to have assistance in getting to a counseling session. So, the first step is to just seek that information.
Awesome, great question. So last one, and this one is about QT Southwestern. They're wondering, oh, hold on, wait, we got something else. We're gonna take this one. This one's from Armin. Being that the enzyme ACE is expressed in the lungs, is there any evidence that ACE inhibitors cause lung cancer?
Well, that's a very complex question, and I'm sure that some of my other colleagues who are at the university that work in genetics, work in enzyme studies could answer that. I cannot, but we do have, again, our phone lines that you can call into. They will get you to our cancer answer line, and they will help you with that question.
Okay, thanks for sharing it. So if somebody does call in, they request an appointment, are there certain people they should ask for when they're calling? Do they need to have a name? Can they just say, I'm interested in X?
If they say, I'm interested in X, we have very well trained people that answer our phones, and they will get you over to our lung cancer screening navigator, and they will take it from there.
Perfect. All right, we are out of time for the day. This has been a fantastic chat. Thank you all for tuning in and for all the questions. Especially want to thank you, Dr. Burrington, for participating.
Well, I thank you for giving me this platform to be able to share this information. Again, I just want to leave your viewers with this information. Screening is not a death sentence. What we want to do is help you live a long and healthy life, and your loved ones live a long and healthy life. And to start off with that is getting past the fear so that you can get the screening done.
Absolutely. Sounds perfect. Well, thank you all for joining us again, and stay tuned for future chats about topics that are just as fascinating. Have a great day.